These are vulnerable kids.
Lawmakers and children's advocates alike continue to sound the alarm over Maryland's foster care system.
And I'm not comfortable that we got the right answers today.
After a hearing on a scathing audit into the Social Services Administration left more questions than answers. Do you believe at the end of the day that you really have been taking all of the urgent steps necessary to save lives? I'm going in depth on the issue, hearing from advocates and lawmakers about what needs to be done to keep Maryland's children safe. Thank you for joining us for this week's edition of Fox 45 News In Depth. I'm Mikenzie Frost. We're continuing our investigation into the state's Social Services Administration after a scathing audit revealed major issues in Maryland's foster care system. Back in September, the Office of Legislative Audits released its findings, claiming the SSA did not meet a slew of state and federal standards. Just 1 week after that audit's release, a teenage girl under the state's care was found dead at a Baltimore hotel. 16-year-old Kanaiyah Ward was supposed to be under one-on-one supervision. Her death was ruled a suicide. In response, Delegate Mike Griffith proposed legislation named for Kanaiya, aimed at keeping children safe. 6 weeks after that audit's release, the Joint Audit and Evaluation Committee held a hearing pressing agency leaders about what went wrong and how to prevent another tragedy in the future.
Welcome to the Joint Audit and Evaluation Committee.
Wednesday,
we're going to turn it over to Brian and his team.
Auditors laid out their findings for lawmakers.
We've had 2 JCR reviews, 4 quarterly status reports, 1 JEC letter of concern, and about $600 million plus spent on an MD Think system to try to go and resolve the system. And we're still here today.
Detailing scathing information about an agency with ongoing problems and concerns dealing with foster care children in the state of Maryland.
Every one of the findings in this report start off with the words SSA did not.
Thank you. All right, I think we're going to call up Secretary Lopez.
Once leadership from the Department of Human Services got in the hot seat,
from day one, we rolled up our sleeves and worked on every single one of these systemic issues.
The audit found several repeat findings of failures for DHS, coming at a high cost to the children and taxpayers.
What are the consequences for not correcting previous audit deficiencies?
We are before you, and we are on the equivalent of academic probation.
Maryland has historically been deficient on these issues. Are there financial penalties? Yes. Did Maryland have those? Yes. Are we course correcting them as a result of what we've learned? Yes. We're building literally in CJAMS new features to make sure that we can respond to these findings. So the stakes are high across the board.
Secretary Raphael Lopez says his department was not tracking foster care hotel placements electronically. Getting a system in place to do that, he argues, took time.
There should be no children in hotels. And so can I say to you publicly, we are working to end that practice? Absolutely. Is anything that we've said so far perfect at absolutely solving it? No, it's not perfect, but you will always catch us trying to bring about change.
Part of that change came on October 22nd, when the agency released this new directive stopping hotel placements for foster care children. And it requires by November 24th, all kids currently in hotels be placed elsewhere.
Why did it take till October 22nd to issue this directive?
I'm going to tell the truth, and it will not resonate with everybody. The first thing we had to do was get a handle on what children were in hotels and why. When we asked the questions early on, we could not get consistent answers.
That guidance came out 1 month after 16-year-old Kanaiyah Ward was found dead in a Baltimore hotel. Ward, in the state's care, struggling with her own mental health. She was supposed to have a one-to-one supervisor contracted through DHS. Her death was ruled a suicide, and now DHS says it's still investigating what went wrong.
It's really sad that we haven't mentioned Kanaiyah Ward.
During the hearing, Republican Delegate Steve Arntz pressing Lopez on DHS's actions following the audit's findings.
You all had a blueprint for what's wrong here. That blueprint was the last audit. I think if we would have addressed these findings, the repeat findings, which is paramount, because a lot of these things would have cleared up a lot of the reasons we're here today. You all knew you had problems, yet those problems continued for quite a long time. And we lost a life. And we don't even know what happened to the other kids in hotels. I'm not so sure a hotel is the thing. I think the process and the attention and the care might have been the problem there and how we address things. So I'm a little concerned. Why weren't these first on your list to address?
There's a possibility that my answer will not be satisfactory to you, sir. My heart is broken over this death. And I ask myself every single day, if we had moved differently and faster on any number of issues, would this precious life still be alive?
While the new directive stops placements in unlicensed settings like hotels, it does not include hospitals.
Why were hospitals and shelters not included in your policy?
We chose to focus on hotels in particular because the risk of having a child in a hotel is far greater than having a child in a hospital. Every single day, we have to make really hard and often ugly decisions.
With all due respect, you didn't answer my question. Are hospitals part of that plan, long-term?
Long-term, yes.
Within a year?
Yes.
The policy also does not specifically ban homeless shelter placement. In a statement to FOX45 News, DHS says it does not endorse the use of youth shelters. If a foster care child is in a shelter, DHS says the agency is required to report the youth's location and move that child to an appropriate placement as soon as possible. The new policy, the most sweeping change in the department since the audit and Ward's death, appears to have already been broken. A child reportedly spent 15 hours in a local social services office, something that's supposed to be prohibited.
I am looking into that with our team, and we will address it because ultimately there is a directive in place, and we will be very clear about holding our department accountable for the directive.
While Lopez is defending his department's actions, making the pitch that changes are happening,
We are at least trying.
House Republicans are calling on Governor Wes Moore to fire the secretary.
Somebody died under his watch, and the processes were under his purview, I guess is what you want to say. And you have to question why somebody who's accountable for this, who's done something. I guess there may be something, a admission of guilt or something like that, but we lost a life. And sadly, that's when we tend to react and act on something, is when we lose a life, and that's not the answer.
But the governor standing up for Lopez and echoing what DHS leadership has been saying.
I know a lot of the challenges that people are debating right now are challenges that took place before our administration came on board, but the commitment that I have is that we are going to fix them in our time, that we're not just going to kick the can down the road. And so I'm confident and thankful for the work that Secretary Lopez has already done and will continue to do to make sure that we are fixing the Department of Human Services and making sure it's serving the people of Maryland better.
When we question the secretary about the timing of the policy shifts, Lopez says it simply took time to get the pieces in place. Do you believe at the end of the day that you really have been taking all of the urgent steps necessary to save lives, given the fact that we did see a child die under your care?
Understood. At the end of the day, yes, we are taking every day seriously. We take seriously every single child's life who is in our care. And on all the issues brought up in the audit, we have been deliberate about working on every single one of them. Are we done? No.
The secretary says by early 2026, the agency intends to have a statewide standard in place for one-to-one contractors. But for some, the steps taken feel more reactive, despite years of being told by auditors where the cracks are in the system.
It's awful suspicious when you read 2024, the audit finished in 2024. That's a problem for me personally, because these issues were there before.
Now, thousands of Maryland foster care children are under the supervision of an agency, still figuring out how to keep them safe.
These are vulnerable kids. To even think that we don't do background checks on somebody, and I'm not comfortable with that we got the right answers today.
Now, I pressed Governor Wes Moore on the issues surrounding DHS again. He doubled down on his message, saying he inherited a broken department. However, we know there have been problems with this department for years. When you took office, you knew about these problems. There were report after report after report detailing the issues within the department. So why should Marylanders trust that there will actually be meaningful change and real accountability when it's taken this long to see some policy shifts?
Well, I'm grateful for the work that Secretary Lopez and the team over at DHS has done to address a lot of these challenges that were longstanding. And so we know that we have more work to do, that there is not one of us that is going to be settled until we have a situation where every single child, every single family, every single Marylander is receiving the supports that they need. But we also know that in order to do that, in order to continue pushing forward the right kind of measures, the right kind of improvements, it means that we have to be committed to having accountability and transparency and improvement.
A quick follow-up, if I can. Advocates argue, though, that there is no accountability within this department right now, and the transparency continues to lack within the agency. How much longer is the public expected to wait to see real results?
Well, I would argue that for anybody who thinks that that there is not transparency, they should spend time with Secretary Lopez and the team, because this is a deeply transparent team.
Joining me now to talk about the hearing and his legislative proposals, Delegate Mike Griffith. Delegate, I appreciate your time again for joining us to talk about all of this. What were your takeaways from the hearing?
Certainly, I was disappointed by the hearing. First and foremost, the fact that the Secretary did not even mention Kanaiya or the tragedy with Kanaiya until pressed by Delegate Arntz on the issue. I would have imagined that under the circumstances, we would have held her up first and talked about it and acknowledged the issue and the issues that led to her suicide. But unfortunately, that wasn't brought up until very late in the hearing, and again, only when pressed.
And looking at the steps that the department says that it has taken since the Moore-Miller administration began, do you believe that the administration really has been acting quick enough to address these problems that, again, have been documented for years?
Well, once again, in fairness, let's acknowledge the fact that these issues have been around for a long time. But the administration definitely had access to the previous audit, and a lot of the findings in the audit that was released last month had many repeat findings as well as a few new ones. But with the repeat findings, we've had almost 3 years now. The administration's had nearly 3 years to address these issues, and largely have not. Lots of conversation about technology yesterday and documentation, but these kids are still in hotel rooms. These kids are still in unlicensed settings. Background checks are not being done. And there was even a debate as to DHS saying they don't have the authority to do these background checks. But even legislators on both sides of the aisle pressed them saying they do. So if you knew these were issues, and you knew these were issues, why did it take Kanaiya's suicide to finally start moving the needle on these issues?
Well, and you brought up legislation, and I want to get to your proposal here because as everything has kind of started to come out about the foster care system, you've started to make some adjustments to this proposed legislation. What's the newest piece involving Kanaiya's law?
The biggest thing is we talk about accountability, and that's what we want to see from the administration is accountability with this. So with our bill, Kanaiya's law, we're going to create an ombudsman position. And this is actually inspired by some previous legislation introduced by Democrats in Annapolis that did not become law, unfortunately. So this ombudsman will act as a independent evaluator, holding the department accountable to make sure they're not only following the law, but making sure these foster kids are getting the services they need.
Do you believe that that will be enough to ensure that change happens and that problems within the department moving forward are addressed in a timely manner?
Again, the size of Maryland's government and the way Maryland's government has been run for a long time, who knows, right? Especially down the line. But you create these laws, you hold people accountable, you create accountability, you at least create the framework to start moving things forward. Mm-hmm. And then as we come together, hopefully as a General Assembly, to pass these laws and to pass future laws, this is at least an important step in the right direction to make sure that this never happens again.
And I know that some of the House Republicans have come out calling for Governor Westmore to fire Secretary Lopez. After what you heard yesterday, do you believe that that is the right approach?
Listen, the Republican caucus did call for that, and that's not something you take lightly, and that's not something that's political in nature, although it may appear that way. I'm sure he's a wonderful person. I'm just not sure. I don't believe he's the right person for the job at this point, and so our caucus believes that.
Yeah. All right, Delegate Griffith, I appreciate your time and insight as always. We'll continue to have this conversation as the process plays out ahead of January. But for now, thank you so much.
Thank you.
Child advocates from across the state are also raising concerns surrounding the Department of Human Services. 3 of those advocates will join the conversation right after the break.
Fox 45 News is Maryland's most trusted news source for local news.
All eyes are on City Hall,
with more viewers tuning into Fox 45 News than any other local news. Fox 45 News, Maryland's local news leader. Fox 45 News, asking the critical questions that ensure accountability.
What steps have you taken to ensure that the problems either have been fixed or will be fixed?
Fox 45 News, we're not afraid to confront the powerful.
When someone treats you like family, you remember it. That's why so many clients send their loved ones to Rice Law. Because we don't just handle cases, we take them personally. Rice Law. Best advice, call Rice.
RiceLawMD.com.
It's the end of summer sale at Jones Junction. Choose from over 350 brand new vehicles, all under $25,000. Financing as low as 1.9%. Jones Junction.
The Medicare Advantage and Prescription Drug Plan annual enrollment period is now open.
Ugh, every year I have to listen to all these commercials.
We're sorry, Karen, and we know it's annoying, but we want to make sure everyone on Medicare knows it's time to check and see if they can enroll in a plan that will save money or include additional benefits.
I just want these commercials to stop.
Honestly, Karen, we do too, but this is the only time of year when everyone on Medicare can call and see if there are plans with additional benefits available in their area.
I already have a Medicare Advantage plan, so these commercials aren't even for me.
Well, Karen, plans may change every year, and the 2026 Medicare Advantage plans are now available.
So, I can call and not sign up for a plan?
Yes, the call and benefits review are free with zero obligation to enroll. Call now.
Just call 800-220-8603. That's 800-220-8603.
This week, A-Rod joins us on Throwback.
Alex Rodriguez, one of the biggest players in baseball history, and now part owner of the Timberwolves and Lynx.
We're talking October baseball and what it's like to own an NBA and WNBA team.
Check out Throwbacks with Alex Rodriguez.
We hope you never need us, but if you're ever injured in an accident, we'll handle everything with trusted guidance and personal attention so you can focus on what matters most, your recovery. Rice Law. Best advice, call Rice.
RiceLawMD.com.
Lawmakers are not the only ones sounding the alarm over the Department of Human Services, so are advocates for the children in the foster care system itself. Joining me now is the State Director of the Maryland CASA Association, Laura Edwards, Tammy Johnson with the CASA Cecil County, and current advocate Katie Stapleford. Thank you all so much for joining us. I know this is a very important topic to all of you, and I want to start with kind of just, Laura, if you want to talk about your takeaways from the hearing itself. I know a lot of people were watching, even if they weren't in Annapolis. What was your biggest takeaway from what you heard from the Secretary?
My biggest takeaway from Secretary Lopez was that there's just no accountability, right? That he didn't know that these things were all necessarily occurring. He, started March 2023. He had to have had the reports, right? This is 3 failed reports. Right. This isn't the first one. That was probably the biggest takeaway, is that we need more accountability across the board.
And I asked him after, and so did a few other people on the panel itself, why did it take this long to come up with some of these changes? And Tammy, the response was, well, it takes time to collect that data, and they were working on the back end. Is that acceptable, given the problems that I know you are very well aware of within the department?
Yeah, so data is important, but this isn't data. These are children, right? They're not a case number. They're not a file number. They're a human being. And so while we understand the importance of the data that they're collecting, these problems should have been addressed immediately. They should have immediately started vetting the issues that were coming up even during the data collection, right? Once they started seeing problems, they could have started softly addressing some of those issues. And instead, it seems like they were waiting to get to the end result before they would actually address any issue. And that's concerning, right? So no, it's not acceptable.
Katie, from your experience working with these children, what is one thing that is actionable that could be done right now to try and address some of these biggest problems?
I would say making sure that all of the individuals who are working with the children, first and foremost, have background checks. We saw that there was 7 individuals, I believe it was. Just making sure that these youth are the priority, that they're the focus. That there was a lot of talk in the hearing yesterday about recouping funds and things of that nature, when I was just wanting to scream from the inside that the children. We need to be, the focus needs to be on them.
On the children,
On the children.
themselves.
And the quality of care that they receive.
And the background checks were sort of eye-opening for a lot of people who don't work in this industry or this world as often as you all do. For some people, this was the first time that they had heard about these problems, and it was a little shocking to find out that people involved with these children and working with them don't necessarily have to have background checks. And I know that the Secretary said by early 2026 they plan to have a statewide plan in place for contractors for these one-to-one vendors, but that's still 2 to 3, if not longer, months away. I guess the question is, do you think that it should take that long?
Absolutely not. You know, I'm a former foster care parent, and I can tell you the rigors that I went through just to become a foster care parent. Background check was first and foremost. And it doesn't take long to do a background check, right? It's something that's super accessible and should not be a holdup.
One of the issues too, dealing with the one-to-one vendors and the contractors themselves, Tammy, talk a little bit about your experience dealing with the problems that you've seen with the vendors and how difficult it has been to try and raise those concerns up the chain.
Absolutely. So in our county, I think I spoke about this before, you know, we were seeing grave issues with these one-to-one providers, really red flags. We were reporting it every time it happened. We were documenting it thoroughly on our end, in our records, and we were providing that information, and we continued to hit roadblocks. We continued to hit the same narrative that was kind of preached yesterday. You know, getting rid of a vendor takes time, and the reality is every day that these children were being accepted, were being, you know, put in these situations, there was further trauma that was occurring. Even when the one-to-ones were finally let go in our county, the specific vendor, because of the things we were reporting, it was traumatic for the children because no one really went in and explained to them about why these people, that even though their behavior was inappropriate, you know, why were they being taken away from them? So it just should not take as long as it did. You know, I can't really disclose the extent of what happened because of confidentiality, but I will tell you what was happening was completely unacceptable. And, you know, no parent in this world would have accepted their child to be subjected to what these children in care were subjected to. I
want to play a little bit for you all and our viewers at home. Part of the hearing where they brought up some of these issues with the vendors. We'll take a listen to that when we come back and more from our conversation after the break. Stay with us.
Here's tonight's primetime lineup on Fox 45. Brought to you locally by your McDonald's owner-operators.
Toyota Performance. Reinventing hybrids. With power you can feel. Camry. An experience for your senses. Buy yours now and save with low 4.99% APR financing. Toyota, let's go places.
An official message from Medicare.
Medicare plans change from one year to the next. And this year, it's important for you to review your current coverage and compare all your options during Medicare open enrollment. Compare health plans. Compare drug coverage. Compare costs. See if you can save. And make sure your drugs are covered. Open enrollment ends December 7th. Compare plans now at Medicare.gov.
Paid for by the U.S. Department of Health and Human Services.
Now you wouldn't Gorilla Glue a bat back together. But you could. Gorilla Glue foams into the surfaces, creating an incredibly strong bond. Let's give it a rip. It worked.
What happens when an unstoppable force meets an immovable raccoon? Attack.
Bark!
Attack. It's not easy taking out the trash. That's why you need strength that's anything but ordinary.
Hefty, hefty, hefty. You seen that life insurance thing I got in the mail?
It's over there.
The recycle bin. I sent for this.
You're buying life insurance now? Have you been to the grocery store lately? The last thing we need is another bill.
That's exactly why we need life insurance. It can help pay those bills. Funeral costs, too. Take a look at this. It costs pennies a day.
That's right. Rates for Colonial Penn Life Insurance start at $9.95 a month. That's 35 cents a day. And this is one bill you know will never go up. A lifetime rate lock guarantees it. Your rate is guaranteed, and so is your acceptance. That makes applying quick and easy. There are no medical questions, no physical exam. Since you can't be turned down, we don't ask about your health. Call for more information and your free gift today.
Call 1-800-253-3556 for free information and a free beneficiary planner. That's 1-800-253-3556. 1-800-253-3556.
Thank you for staying with us. We're continuing our conversation surrounding the State Department of Human Services, and I want to jump right into our conversation and go right to that soundbite looking at the hearing that we heard on Wednesday. And this was a debate between a lawmaker and the department dealing with the issues when it comes to contractors and how notification is handled. Take a listen.
The Office of Licensing and Monitoring reviews any incidents that are reported to us, and they are by provider, as you said. And so what we do is, rather than have the onus on our case managers or our locals, we have those reports come to us centrally, and then we centrally notify our sister agencies when private providers find themselves out of compliance with a regulatory requirement related to their license. The first thing we do is look at a corrective action plan. And we ask the provider to not only look at the action individually, but to determine if this could be a systemic issue among the providers. Like, we want you to really look at, is this going to be a problem going forward? If we find that the license deficiency or the regulatory deficiency is significant enough that it could impact the safety and well-being of children, then we look to licensing actions.
Now, I want to ask you, do you think that it should take all of those steps to really deal with some of the problems if these contractors are working with children? Katie?
That's too long. It's too long. Too much can happen in that time, and these children are vulnerable, and it's not working.
Laura, I want to ask, the work group was supposed to meet about dealing with some of these problems. The group itself didn't meet until after the report was due. You're part of the work group. When can the public perhaps see some findings?
Absolutely. So I'm the chair of the unlicensed setting and overstay work group. We were due to convene in early September, or June originally. We convened informally in September. We all got our appointment letters mid-September. Report was originally due October 1. We didn't have our first meeting until then.
Right, right.
All of that being said, our goal is to create these subgroups. We've already had our first meetings. We're getting readout reports every single month, and they're meeting every month in between our monthly meetings. What we're hoping to do is by February, provide a short brief, right? A summary brief, if you will, so that we can make some impact with the Assembly while it's in session.
That makes sense. Before the final report is due, perhaps when lawmakers are out of session.
Exactly.
Yeah.
The goal would be between April and end of May to have the full comprehensive report completed.
A lot of people will be waiting to see what is in that. I appreciate all three of your time. Thank you so much for joining us and providing your insight. This is an incredibly important conversation. I hope to keep this dialogue going. We'll have to leave it there for now. That's it for this week's edition of Fox 45 News in Depth. I'm Mikenzie Frost. Thanks for watching and have a great rest of your day. Hey, I'm Mikenzie Frost. Thanks for watching. Don't forget to like this video and subscribe to our channel. Check out Fox Baltimore on all of our social media pages for more videos just like this.